Welcome to our health talk today. I'd like to introduce Julie Steiner. She is a wellness nurse that works in AultCare, and today we'll be discussing the difference between headaches and migraines. Julie will cover causes of headaches and migraines, treatment options, including natural, complementary, and alternate medicine and potential complications. Thank you, Julie, and welcome.
Thanks for having me. So yeah, exactly what you just said, Lee. I just have some of the different objectives here for the presentation today, but we will be discussing the definition of headaches and migraines, as well as the difference between the two. We will talk about some of the common triggers that might lead to a headache or migraine, both the pharmacological and alternative treatments that might be available to someone. And then lastly, I will cover some of the different lifestyle considerations or things that we can do for better management and relief. At the end of the presentation, I will open it to any questions that you might have, just keeping in mind that I am not a specialist or expert in headaches and migraines, but I am a nurse, and so I'll do my best to answer any questions. So first we'll start with headaches. A headache, as we all know, is a common form of pain that affects either the head or the face. Often this pain is described as throbbing, but it can also be sharp, dull, and or constant. There are many different types of headaches, and in fact, there are more than 150 of them. And we categorize these into two main categories. We have your primary headaches and your secondary headaches. A primary headache is not caused by a medical condition or any type of disorder. It's caused by an overactivity of or a problem with these pain-sensitive structures that are in our head. So here are a couple examples of primary headaches. You have your tension headaches, and this is the most common form of headache pain. Statistically, they say about 90% of people have experienced a tension headache before. The pain from these headaches tend to spread across both sides of the head, often starting in the back and then creeping forward. Some describe the pain as like they have a tight band wrapped around their head, so a lot of pressure. Things like eye strain, stress, and even hunger can frequently cause tension headaches. Cluster headaches are less common, but these are very, very painful, and they occur in clusters or patterns. So the person might experience frequent attacks, sometimes multiple times a day for weeks or even months. And then usually there's a long period of relief. The pain itself is often located behind one eye or in the temple area. What's interesting about cluster headaches that kind of differs from other headaches is that, when we might develop a headache, we don't have cluster headaches. We might just want to be in a quiet room and lay down. But with the cluster headaches, individuals who have these might actually be restless and rock back and forth. Again, these are just very, very painful. A secondary headache is different from a primary headache because the headache is a symptom of a disease. And that disease is activating those pain-sensitive nerves of the head. There's many different conditions that can lead to a secondary headache. I just have a few that are listed here. So the first one, you have your sinus congestion, and we've all probably been there before. We know we can develop a headache from the swelling of the nasal passages. And often that pain is felt in the front of the face. So you get the pain behind your cheeks, your nose, and your eyes. That pain is often worse when we wake up in the morning and then also when we bend over. Then you can see some other examples of the secondary headaches. It could be from a head injury, infection, high blood pressure, in rare cases, a tumor. But again, that secondary headache is always a result of something else that's going on. Now, a migraine is a type of headache, and it's specifically a primary headache. So there's no underlying disease that's causing this. If you have migraines, or if you know someone who suffers from them, you know that that pain can be so severe and unbearable at times. Experts estimate that about 12% of Americans do get migraine headaches. The exact cause of migraines is unknown, but researchers believe that they are a result of when these unstable nerve cells in our brain overreact to different factors. And in this presentation, I'll refer to those as triggers. So when we're exposed to these triggers, we have these changes in chemicals and nerves and blood vessels that are occurring in our brain. There's a lot of inflammation, and then as a result, you get that disabling pain. Unlike other types of headaches, individuals who experience migraines might also have some of these other symptoms too. So the migraine might be accompanied with things like nausea and vomiting, sensitivity to light, sound, or smells, dizziness, and fatigue. So you couple these symptoms with the head pain itself, and you can see how this could really be debilitating for many people and can interfere with, daily lives. A migraine episode might occur in 4 different phases, though not everyone experiences every one of these phases. The first one is the prodrome phase, and this is the pre-headache phase. This can occur sometimes hours or even days before the migraine actually hits, and it involves these painless symptoms. These symptoms could be mood swings, food cravings, or stiffness of the neck, just for an example. The second phase is the aura phase. Auras are sensory disturbances that can occur before or during a migraine. Individuals who suffer from seizure disorders also may experience auras right before the seizure. Examples of auras might include things like blurred vision, blind spots, or just a funny feeling, like something just feels a little off. And that could be a sign for some people that a migraine is coming on. The next phase is the headache phase. This is when that pain usually hits. It can last anywhere from 4 hours to 72 hours. And the pain is often described as, again, a throbbing, tight pain, drilling. I've also read where it's been described as almost having like an ice pick stuck in the individual's head. So very painful. And typically the pain will start on one side of the head and then spread to the other side. Your last phase is the postdromal phase. And this is when the headache pain has subsided. And at this point, the person might feel very exhausted, just unwell. And this stage can go on for a day or two. This phase specifically is not uncommon. About 80% of people who suffer from migraines will experience the postdromal symptoms. As mentioned, migraines can be a result of various triggers. So here are some examples of those. You have gender and hormonal shifts. Women are 3 times more likely than men to suffer from this. And then hormonal medications, things like birth control, hormone replacement therapies, all of those can worsen migraines. Allergies might be a trigger for some people. Family history and genetics. 80% of people who get migraine headaches have a first-degree relative who also suffer from the disease. So that would be like mom, dad, or sibling. And then environmental. This category includes a wide range of different triggers, anything from weather to light, stress, lack of sleep. Food is a big one that we'll talk about later on, but all of these different things can definitely play a role. And things like family history and genetics, unfortunately, we can't change, but there might be some things in that environmental category that we can change or control our exposure to. So, that is going to be helpful when we talk about prevention. There might be things we can do to help lessen frequency or severity of the migraine. With the diagnosis, there's no blood test or scan that will tell a doctor that a person's head pain is a migraine. The only real way for your doctor to know is to talk with you. And so they're going to ask many different questions and also looking at things like medical history, family history, as well as the symptoms. How often are you having the migraines? Are you experiencing auras or some of those other symptoms that go along with the head pain? Depending on the situation and the severity of the condition, a doctor might refer someone to a neurologist who does specialize in headaches and migraines. And then also, if a person's condition is unusual or it becomes severe, tests to rule out other things that might be contributing to the headache might be ordered, such as a CT scan or an MRI scan, to figure out what that underlying cause might be. When we're talking about treatment, it's important to understand that migraine headaches are chronic. So they can't be cured, but they can be managed and possibly improved. There's so many different medications out there. First ones, over-the-counter medications. These are often effective for people who have more mild to moderate migraines. Acetaminophen or Tylenol and ibuprofen can be very helpful for some people. Excedrin migraine is another popular one, and that's actually a combination of acetaminophen, aspirin, and caffeine, which we'll talk a little bit about caffeine in a minute, but there's some different kinds. I know there's like Advil migraine, and Excedrin migraines is a big one as well. So some of those might be effective depending on the severity of the migraine. You also have your prescription pain relieving medications. And these drugs are taken during that migraine attack to stop the headache process and even alleviate some of those other symptoms that come with it. These can come in many different forms, anything from pills to nasal sprays, injections, infusions, so many different types. And then your preventive medications, these are going to be taken more on a daily or regular basis to help prevent migraines in the future. Again, so many different kinds out there. Some doctors might prescribe blood pressure medications, antidepressants, anti-anxiety, and even Botox. You might have heard of that. Botox has been used for preventive measures. So when we're talking about treatment and medications, I just always tell people it really is individualized, and it's up to the individual and their healthcare provider to determine what specific medication or combination of meds is best. A doctor or specialist might also recommend natural supplements. So here's a list of some that have been studied or are currently being studied for migraines. And again, if you're interested, I would definitely recommend just having that discussion with your doctor. Um, the one that I do want to talk about is melatonin at the bottom of the list there. Melatonin is widely used as a sleep aid. So, especially if lack of sleep is an underlying trigger for some people, that's where melatonin might be useful. And then also, studies show that those cluster headaches can be linked to low melatonin levels. So, might also be helpful for individuals who suffer from those. In addition to those natural supplements, we also have alternative medicine. And this is becoming very popular and, again, widely used for a number of different things. Here's some examples of alternative medicine. You have things like acupuncture, chiropractic care, massage therapy. You could either go to a therapist or you could even do self massage. Relief could come from just massaging the scalp or massaging or applying pressure to the temples in a circular motion. Some people report relief when doing that. Meditation. Studies show that keeping self in a calm state can help to reduce pain. And yoga. Yoga is a great low impact type of exercise, but it's also a form of stretching and meditation, and there's so many benefits. Also helps to reduce sleep issues, anxiety, and stress, which again are those environmental triggers that we sometimes see. When we're talking about what to do for relief during the actual migraine episode or even a headache, it's really important to take a break from whatever you are doing, step away and try to get into a dark room or area where it's quiet. Because again, migraines do trigger or cause increased sensitivity to light and sound. So relax, try to get some sleep if you can. For some people, temperature therapy is helpful. Some report that applying cold compresses to the forehead and the back of the neck area. Others say that heat helps. So, this could be hot packs or heat pads, and that can help relax any tense muscles. So that really depends on the type of headache and the person. It might even involve a combination of the two. And then drinking a caffeinated beverage in small amounts. And the key words there are small amounts. Caffeine can be effective for relieving migraine pain, especially in the earlier stages, as well as enhancing the effects of medications like Tylenol or acetaminophen, which is one of the reasons why we see caffeine in that Excedrin migraine. But you do need to be careful because drinking too much caffeine can actually have the opposite effect, can lead to caffeine withdrawal, as well as sleep issues. Might not be able to fall asleep. So you have to be careful with the caffeine, but it could be helpful in small amounts. Consider your eating habits. A couple things here. It's important to be consistent with when you're eating, so trying to eat at the same time every day, and then not skipping meals. Working in the wellness field, one of the big things is intermittent fasting. A lot of people are doing that, where maybe they're not eating for about 16 hours. They're fasting through the night and not eating breakfast. And there's different studies out there on that show some of the potential health benefits. But for people who suffer from migraines, it may not be a good idea because that could be a trigger. So try not to skip meals and also avoid any foods that could trigger the migraines. If you suspect that there's a certain food that is causing it, then eliminate it and see what happens. So as promised, here are some commonly reported food and drink triggers. There's quite a list there, and there's probably many more. Um, but those are just some examples for you. As we discussed, sleep problems and migraines often are linked. So it's important to practice good sleep hygiene. Even if you don't experience migraine, we still should all be aiming for the 7 to 9 hours of sleep every night. So here are just a few tips to help you do that. The first one is to keep a regular bedtime and wake cycle. So this is going to bed at the same time every night and waking up at the same time every morning. People will say, well, what about the weekends? That's sometimes impossible on the weekends. That's okay. Just try not to deviate about, let's say, 60 to 90 minutes from your regular time. Make your bed a sleep-only zone. And the idea here is just to avoid any distractions that could prevent you from falling asleep or staying asleep. Maybe this is getting rid of the devices, getting them out of the room, charging in a different room. So if you do wake up, you're not tempted to look at the screen and now you're looking at that blue light and you're awake. Maybe you need to get the animals out of the room, the dog, the cat, whatever that looks like. But that can certainly help. Maintain a bedtime routine. And this is just doing the same thing every night before bed, which can signal your brain and your body that it's time to go to sleep or get ready to sleep. And also making time to wind down. We recommend about 30 minutes before bed, you want to do something relaxing. You definitely want to dim the lights, especially this time of year. You want to close the blinds because it's probably very bright still at 9:30, and do something relaxing. It's whether it's reading, getting a warm bath. Again, that looks different for everyone, but that will help to increase melatonin production, and then hopefully we'll be ready after those 30 minutes. And limit caffeine. We say try to limit 6 hours before bed if you can, especially if sleep is an issue for you. For those that are caffeine sensitive, they might want to limit no later than noon. Exercise. During physical activity, our body releases chemicals that block pain signals to our brain. These chemicals also help with symptoms of anxiety and depression, which are two conditions that make migraines worse. So all the reason why we should be exercising consistently. Always important, especially if you're not exercising right now, it's always important to talk with your doctor before starting any type of new routine. I will say that things like walking, cycling, or swimming might be really good activities because you can do these at your own pace. They're fairly easy on our joints, and that is something you have to pay attention to because vigorous activity can trigger migraines as well. So you want to make sure you're doing something more, moderate, intense activity. And just as a recommendation or an FYI, the American Heart Association recommends that we get 150 minutes of moderate intense activity a week. So if you're exercising 5 days a week, that would mean 30 minutes each day would get you to the 150. And then it's important to manage stress. This is one of those environmental triggers that definitely could lead to migraines if it's not managed well. So these are just some suggestions. Feel free to try these if you're not already doing these. The first one is to simplify your life. And this involves trying not to squeeze everything into one single day. Spread chores or activities out throughout the week. And then this might also involve learning to say no, which, if it's appropriate, say no. And I know that's, as humans, that's a very hard thing to do, but it certainly might help. Manage your time wisely. Create a to-do list for work and at home, whatever that might look like. Cross things off as you accomplish them. Just try to be more organized. Take a break. If you feel overwhelmed, whether it's at work or home, take a step back, maybe do some stretches, maybe go for a quick walk. Sometimes we need that just to renew our energy and get refocused. Adjust your attitude. This is all about staying positive. If you find yourself thinking in a negative way, maybe you think, oh, this can't be done, or this is going to be too difficult. Try to switch gears a little bit and think instead, yes, this is going to be tough, but I can do this, or I will do this. I always do this. So just that small little change and how we're thinking can help. We call these positive affirmations, and it can really help in many areas of our life. Enjoy yourself. Find 15 minutes every single day that you can do something that you enjoy, or just providing that you time that we all deserve. And relaxation. This looks different for everyone as well. For some people, they might just want to sit on the porch, listen to the birds. That might be relaxing to them. One technique that I really like that I wanted to speak to is deep breathing. And the reason for that is this is a very simple exercise, and it's something that you can do anywhere at any time, and no one would look at you like you're crazy. But deep breathing is when a person focuses on their breathing. They inhale through their nose, exhale through their mouth. The breathing occurs slowly, and it can occur over maybe 5 minutes that you do this activity for. While you're focusing on the deep breathing, the hope is that some of those racing thoughts kind of go away. Naturally, muscles are going to relax, heart rate will decrease, respiratory rate decreases, and then it's hard, not to feel calm after you practice that. So I would really encourage people, especially if stress and anxiety is an issue, to maybe try to do that every day, because there's so many benefits to that. And then, of course, I would recommend, if you're experiencing a lot of anxiety or stress in your life, to just reach out to someone. This could be a friend, coworker, or even a counselor. But, often it can help to talk about our feelings and just kind of get them out in the open. And then keep a migraine diary. This is so important for someone who's suffering from migraines because of all of those things that could be a trigger. And sometimes it's hard to pinpoint exactly what the cause is. So keeping a diary to determine what those triggers are, and then also to document what you were doing before the migraine, during, what provided relief, and so forth. And then you can take that to your doctor, and that might help with a diagnosis or help to choose the appropriate treatment. And then the last thing that I wanted to discuss is just if you have any of these symptoms, you should most likely give your doctor a call and schedule an appointment to get in. So if you have a new headache that just doesn't seem right, you're concerned about it, a headache that is progressively getting worse, or one that has gotten worse after a headache, or any of those symptoms in that second bullet point, I would absolutely reach out and schedule an appointment with your doctor.